This is Gene Monterestelli, and welcome to the Tapping Q&A podcast, recorded live to tape from Williamsburg in Brooklyn. This is episode 261, originally aired March 8th, 2017. Hi, everyone. I hope this finds you well wherever you are and whatever time of day you're getting a chance to listen to this. Thanks for spending some time with me today. We have a conversation about fibromyalgia and how to approach fibromyalgia. Before we do that, the first thing I'd like to do is I would like to thank Amy, John D., and Renee. They're the three most recent people to support the Tapping Q&A podcast. We are now 2/3 of our way to our goal of being able to transcribe all of the interviews that you hear on the podcast. So in addition to the audio, you'll get a chance to be able to read them, print them out, because other people learn that way as well. If you'd like to support the podcast and get some awesome gifts, all you need to do is go to tappingqa.com/support. If you're listening to this in the website, you can just see the little link above the player. If you're in an app, you can click on the link from the show notes. Also, if you have not done so already, we have a free 10-part guide on how you can use tapping to eliminate self-sabotage. All you need to do is go to tappingqa.com, click on the big blue button. If you're listening to this in the website, if you go up to the sidebar on the right-hand side, you will see the button where you can find that. And if you could see me here in the studio as I'm recording this, you can see me pointing where the button is. So today's conversation is about fibromyalgia. And if you listened to the 8-year anniversary podcast last week, you heard me talking about how this is a topic that I've always wanted to cover. And I've wanted to cover it for a couple of reasons. The first is it isn't something that I have any sort of experience with as a practitioner. I've never had a client come to me, or if I've had people come to me, I've just sent them and referred them to someone else because it's just not my specialty, and I always want to be helpful, and it was just outside of my depth. The second thing was that I've read lots of case studies and heard lots of people talk about, and I've been asked many times, how to use tapping for fibromyalgia, because there doesn't seem to be anybody out there who is using tapping who has a great deal of success with the issue. It's one of the two issues physically in which tapping, it's not that it is unsuccessful with it, but success is fewer and far between than the other issues. So I wanted to get some experience and have a conversation with someone who's been treating this for a long time. I got a chance to talk to Dr. Norm Shealy. He has been working with fibromyalgia since the 70s, so he has decades and decades of experience. And as you listen through the conversation and as you hear him talk about the reasons why people get caught in that place and the protocols and tools that he is using to respond to it, it starts to come clear why tapping is not enough for an issue like fibromyalgia. And I think it's important for us to hear that, because oftentimes, as wonderful as tapping is, we can think it is the only thing and the best thing. And here's a good example of how it's a good thing to be using, but it's not the only thing that is necessary. So here is my conversation with Dr. Shealy about tapping and fibromyalgia. Just to begin with, I'm in a circumstance where I hear fibromyalgia thrown around quite a bit. I have clients showing up with it. I have sometimes people self-diagnosing themselves in that. When you use the term fibromyalgia, what do you mean by that term?
Well, I'd like to tell you first what I call it, which is frozen fear.
Great.
Now, I want to tell you why I call it that. It does not mean necessarily that it is a psychological, emotional fear. It means that something significantly traumatic happened that set the autonomic nervous system, the adrenal glands, etc., into essentially overdrive.
Okay.
And it doesn't get out of it. So it can be an injury, it could be surgery, it could be a serious viral infection, obviously it could be a serious emotional trauma. But whatever it is that started it, it just doesn't go away. In other words, it's as if your foot got stuck on the gas pedal. And then that causes this panorama of symptoms, which leads to muscle spasm and pain and loss of magnesium. You know, every time you have a stress response, which puts out a little shot of adrenaline, you actually lose magnesium.
Okay.
And so one of the major contributions that leads to chronic problems like fibromyalgia is low levels of magnesium, not in the blood, but in the cells, because the blood will steal magnesium from your bones until you don't have any bones left to keep the blood level. But the only accurate test is really what's called intracellular magnesium, which only one lab in the country does, Intracellular Diagnostics, plural, in Medford, Oregon. But I could just give you a 99+% chance that you've got a low intracellular magnesium if you've got fibromyalgia. There are other things that go with it. This leads to depression. It leads to anxiety. People with this problem are often deficient in the amino acid taurine. And interestingly, it is the amino acid taurine and magnesium which maintain the normal electrical charge on your nerve cells. In other words, in a normal situation, our nerve cells have minus 60 to 70 millivolts of charge on them. If it gets up to minus 40, they're all over the place. If it gets down to minus 90, they don't act at all. So you get some extreme just because of lack of magnesium and or taurine. Those are only two of the metabolic chemical contributions. But it's a major problem that can be very serious and go on for years and years.
And so you mentioned that there's a whole kind of panoply of symptoms that come with that. What is kind of a laundry list of physically something someone is going through when they experience this?
Well, the main thing is pain in multiple muscle groups. I mean, more or less half or more of the body. Much of the shoulders, all around the back and the buttocks, sometimes in the arms and legs themselves. But it's muscle pain, muscle soreness, limitation of movement, and of course that leads to all kinds of other things, including depression and anxiety. So the big ones are those.
And so then, if we're talking about this thing that's causing the symptom to freeze, and you had a list of a whole number of things, when someone shows up to work with you, how then do you go through the process of figuring out what is the root cause or what is causing something to stick? And maybe you're not even worried about that. You're just simply going into doing things to help them to feel better. Someone walks in the door. This is the diagnosis. What is your initial process?
Well, I talk with them about what I recommend, because what I say to someone with this disease is, I need 6 to 12 weeks of work with you. Not that you have to be in my office all that time.
Right.
But this is not something you can cure overnight. There's no drug in the world that's worth anything, number one. Number two, you are deficient in magnesium, and my ideal would be to give you a minimum of 10 IVs of magnesium chloride intravenously with the supplement you always give, a Myers cocktail, so-called. In that, depending upon all of your other symptoms, I would use anywhere from 2 to 25 grams of vitamin C, because your immune system is weak. But the most important thing is the magnesium. Secondly, your electrical system is short-circuited. In fact, I consider fibromyalgia part of what I call electromagnetic dysthymia. Now, that's a term I created, but what it really means is the electrical system, brain, spinal cord, peripheral nerves, are short-circuited. They're not working right. And if you do an EEG on somebody with these kinds of problems, what you will find is asymmetry. The two sides of the brain at rest should be absolutely equal in the amount of alpha, gamma, delta, whatever, in various parts of the brain. In these people, there'll be 60% of the time a focus of increased activity in the right frontal lobe. 40% of the time, it's in some other part of the brain, but always 100% of the time, the EEG is actually abnormal, showing electromagnetic dysthymia. So the second treatment is what was originally introduced in 1975 as the LISS, L-I-S-S, cranial electrical stimulator. When Saul died about 10 years ago, it was bought by a company called Fisher Wallace, and it is still on the market. So use of the cranial electrical stimulator every morning for an hour is an excellent thing to help reset the electrical system of the brain. The third most important thing is what I call biogenics. Now, this all came about starting in 1972 when I got introduced to autogenic training. Autogenic training is a self-regulation, self-hypnosis tool that was introduced in 1912 by Johann H. Schultz. It is the most studied self-regulation tool in history. As of now, there are 17,000 scientific references showing how beneficial just plain old autogenic training can be. I went back in 74 to 77 to get my Ph.D. in psychology to look at, well, what else is there in the literature for self-regulation? What I discovered is there are a number of related tools that go in every society, for hundreds of years. And so I developed a system of mental retraining of the nervous system that I call biogenics. And that is you can talk to the body. That's autogenic training. You can tense the muscle systematically and let go. That is progressive relaxation. You can learn to control the feelings in any part of the body. You can learn that by breathing and collecting an unpleasant sensation like a general vacuum cleaner and breathing it away. You can learn to breathe through a part of the body. That's an Eastern Indian technique. And I learned that if you focus on one part of the body for 20 minutes, just imagine you're breathing through the skin of your right hand. You can actually make your right hand numb. Once you perfected that, you can transfer it to any other part of the body. So that's just another of these techniques. Everything in the body being electrical, you can imagine you're circulating mentally the electricity up the back and down the front as you breathe. And you can think of the fact that your body being electrical, it has an electromagnetic field around it because electricity creates magnetism. And so we teach people to create a 1-inch electromagnetic field starting at the toes all the way up to the top of the head, and then a 12-inch halo capsule around from the tips of the toes to the top of the head. And when you get into that state, the brain, mind are very alert, but the body actually feels as if it's floating in space. And so this takes, again, 6 to 12 weeks of daily practice, one or another of these kinds of exercises to retrain the body and mind.
When this occurs, when someone gets into this moment where they get frozen in this fear freeze that happens to them, what is the common trigger? Is it a new trauma? Is it a trauma that's related to something that is from a past? Like, what is going on when that happens, or is there not a consistent reason why we get stuck in that way?
It's not consistent, to say the least, but with unfinished anger, guilt, anxiety, depression. So something in this life that triggers it, either an emotional thing or a physical thing that just puts them down, revisits that ancient memory and sort of keeps it going.
And are you, when doing this sort of work, are you interested at all in trying to figure out what has re-triggered it? Or is that something that's inconsequential? It just happens to be the switch that turned it back on, and being able to do treatment is not connected or related to that?
Unless it's pretty obvious from an emotional thing in this life. In other words, if it happened after an infection or an injury or what have you, I don't think it's so important to focus on this life.
And as earlier when you were talking about the symptoms and people I've known who've dealt with symptoms like this, the sense of dealing with anxiety, depression, and the emotional issues that come with just dealing with this thing that is physically constantly there. when you are doing treatments and protocols, are you spending any time dealing with the emotional health? Are you waiting until you get through the physical protocols? Like, as you're dealing with that, are you interacting with that in any particular way?
At the same time.
At the same time?
In other words, ideally, I would spend 40 hours, 1 week, 8 hours a day, teaching people all these principles of self-regulation while beginning the process of giving them the IVs.
Okay.
If I can't do that, well, we do the IVs and maybe an hour a day or a week or whenever we can get them to work at it.
And when you're teaching them the self-regulation tools, are you doing that one-on-one? Are you doing it in groups? What does that actually look like? One-on-one.
We do it. Yeah, we used to do it in groups, but it's really better just to do it one-on-one. And, of course, after the first couple of live sessions, we have a lot of CDs or MP3s we can use.
Right. Once they have a sense of what's going on. And in your history in working with stuff and kind of taking this multi-pronged approach, how long have you been using this multi-pronged approach?
Oh, since about 1975 or 6.
Mm-hmm. And over the course of that time, what has kind of the success rate of the work that you've been doing with folks who show up and are willing to give it the time?
85%.
In those instances where it hasn't been successful, have you been able to identify something consistently that is showing up? Is there a symptom that is there? Is there an experience that's there that's when you see that, there's a flag up in your head going, boy, they're going to be an outlier and this is going to be more difficult?
The most important outlier is a person who is just damn angry.
Okay.
You know, when you see that, you can look at them and know it, and you feel it when you talk with them. Anger is very, very much more difficult than sadness or anxiety.
Yeah, because I mean, anger is the information of I'm being attacked. And if someone's in that state of attack, I can see how they're responding to protect themselves and how on some level they're not going to be open to any sort of transformation because they're trying to be so protective at that point.
Exactly.
So when it comes to fibromyalgia, what do you think are some of the most common cultural misperceptions that we have about that and responding to it? Well,
I don't know what the average general population thinks about it, but I do know what the average physician does.
Yeah, great. That would be awesome.
They don't understand it at all.
Mm-hmm.
And they often call these people crocs. They believe that they're faking or making it up, and that is totally wrong.
What's the question that I haven't asked yet about this that I should be asking you that's going to be most useful for people to hear the answer to?
Well, the real question is, can I get over it? Mm-hmm. The answer is yes. If you are willing to be honest, if you're willing to forgive the people that you're angry at, totally forgive them, be done with it, and willing to work with an holistically oriented physician, yes.
It's more than just a commitment to being healthy. It's requiring a commitment of me being willing to level with myself and my own experience and healing and transforming the things that I might not want to look square in the eye.
You got it.
Do you use, in your work with this or any of the other stuff that you do you use any of the tapping protocols with your clients?
Oh, yes. All kinds of things can be very useful, and tapping specific points or specific acupuncture circuits can be very useful.
Is there something when responding to the symptoms of fibromyalgia in that regard that you've seen to be most successful?
The single most successful is a circuit in the body which I call the Ring of Air. 13 specific acupuncture points, which, when stimulated, and they're best stimulated by tapping each of the 13 points with a mixture of essential oils, but it can be done with the fingers or electricity.
Yeah.
That raises oxytocin, and oxytocin is a bonding, nurturing hormone, but it is particularly good for anxiety and depression.
Excellent. Well, very good. To be honest, when we started the conversation, because I know so little about fibromyalgia, I had no idea where this was going to land. So I really appreciate the information. Thanks for your time, Doctor.
Hey, you are most welcome. Have a great day.
So there you go. That was a fascinating conversation, and I had no idea what we were getting into and was learning right along with you as we went through that information. If you would like more information on Dr. Shealy, including a link to the Ring of Air protocol, which he talked about in the interview, all you need to do is go to tappingqandapodcast.com, click on the link for episode 261. If you are listening to this in the website right now, if you look down below the player, you'll see all of Shealy's contact information. And then just below his contact information, I have a link to the Ring of Air. If you're listening to this in the Tapping Q&A app, or if you happen to be listening to it in any podcast player, just go to the show notes where you will see a link to the support link, but also a link to the Ring of Air and Dr. Shealy's information. When you go to the Ring of Air webpage that's there, there's a video of him demonstrating it, as well as photos of the body showing you where those 13 points are. You might find that tool something useful you want to add to your repertoire of self-care. If you have a question, a comment, a topic that you'd like to see us cover in the future, someone you think I should be talking to, please let me know. Gene, Gene, at tappingqa.com, or you can just go to tappingqa.com, click on the link up in the menu bar that says contact. It will take you to a form to drop me a note. If you have the app, just click on contact in the app. You can leave me a voicemail or send me a text message from right inside of the app. If you don't have the app yet, go to tappingqandapodcast.com, where in addition to having access to all of the audios from the shows, you also have access to the tapping scripts from any of the past tap-alongs. And when we get to the point where we're going to be able to start adding the transcripts to the website, the transcripts will show up in the app as well, so you can just check out all of that information there. Please, if you haven't done so already, you can subscribe to the show in iTunes, Stitcher, TuneIn, iHeartRadio, the Google Music Play Store. We are still the #1 EFT podcast in the Google Music Play Store because we are still the only EFT podcast in the Google Music Play Store. And finally, if there's someone you know who could use the information we shared today, please pass it along. With the 8th anniversary episode that I put up last week, I received a lot of notes from people saying how much they love the show, but more importantly, they shared how much they love sharing the podcast with other people. It's free content that is transformative. Pass it on. Don't spam your inbox and send it to everybody in the world. But if you know someone who might use today's information or any information from a past episode, please, please, please be our ambassador. Pass that information along. It would mean the world to me. For the Tapping Q&A podcast, this is Gene Montrestelli. I hope you have a great day, and I will talk to you real soon. Bye-bye. The Tapping Q&A podcast is copyright Gene Montrestelli, Tapping Q&A 2016. All views expressed by guests are those of the guests and not necessarily of Gene Montrestelli or Tapping Q&A.